So good afternoon and welcome. We definitely have a full house, and we are so excited with our guest today. I'm going to get into that in just a moment. While you're all now telling us where you're from, I also want you to recognize or to find the Q&A. We are going to have time to ask questions a bit later. So make sure that you're dropping your questions either into the chat or the Q&A, and ideally the Q&A so we can centralize all of those questions, because I'm sure you're going to have many. It's been over a week since we got together, and things are shifting and changing quickly. The COVID-19 virus is still the major topic of conversation, but we're also noticing that we're seeing the sun shining through for some of us. I hope it's sunny where you are. And with that comes a little bit of hope as spring begins to break. And it's so nice to feel the warmer weather and to feel the sun shining. But with that, physical and social distancing are still incredibly important. So make sure you're staying a safe distance away from others. However, if you can, try and get a little fresh air in, perhaps in your backyard or on the balcony. And if these aren't available, maybe take a walk far away from other people. Fresh air, movement, nature, these are all great healers. And healing, of course, is a main topic during this pandemic. And in speaking with our guest, Zayna Khayat, I understand there's a power shift occurring from healthcare provider to people-powered healthcare. And think about that during this pandemic. What could that mean? Now, I've worked with Zayna for years now, and I am incredibly excited for you to hear directly from her today about the patient revolution and how employers are getting into the game by becoming healthcare organizations themselves. Compelling, right? Well, with that little tease, I'm going to introduce you to Zayna. She's a health futurist that's sought after by many global companies and conferences that want to get ahead in health and innovation. Her work and research have collaboratively urged her audiences to demand more from their healthcare. Zayna was previously the lead of health system innovation at Mars Discovery District, right here in Toronto. Currently, Zayna is the Future Strategist with SE Health, formerly St. Elizabeth Healthcare, a health and social impact enterprise with a major focus on creating a better future for aging adults in their homes and in their communities. Welcome, Zayna. Now, I'm hoping you can unpack some of what I've just teased the audience with.
Thank you for having me. Great to see a lot of familiar faces and some new ones. Look, I'm going to share a little bit of perspective first in slides, and then we're going to move into a conversation. And I know Andrea and the team are kind of monitoring the chat. We have a pretty diverse group of people. Some of you know more about healthcare than I do. I can tell from who's on, and others might be just trying to understand what the future of health and healthcare is given what's going on. So I'm going to take a stab at sharing that from my perspective as a future strategist. I'm going to open with, this pretty shocking quote, I'd say, that my colleague, a really big thinker, John Singer, wrote, reflecting on how our capital markets around the world have collapsed. And who would have thought, that for the longest time, we've treated capital markets as this separate thing from this public good called healthcare. And the two are inextricably linked. And that's got a lot of implications for everything we do, both as citizens and taxpayers, as employers, and of course, those of us who work in the sector that the world is now depending on our innovation to get our world working again. So just first, let's unpack the word health versus healthcare. In 2011, leaders from around the world got together, including a pretty prominent Canadian physician, Dr. Alex Haddad, who works at a University Health Network, to say, the world has changed since we built institutions of health and healthcare, which was really after World War II with the World Health Organization. Maybe we need a new definition to reflect what we expect from healthcare and what we define as health. And they did come up with a new definition, and that was published in this issue of the British Medical Journal, that health is the capacity of a person or their community. So community was built into the definition that was not in there before, to both adapt and self-manage in the face of physical, mental, or social challenges. So this sounds like motherhood, but it's a very important sets of words. It's about how you and your community can adapt. So if you were wearing glasses like Andrea is, in the old definition, you weren't healthy because you had bad eyesight. But if you're adapting in the face of that physical challenge in that example, and then more importantly, they added mental and social. So this is what we're here to create in our lives and through healthcare systems. And that's a pretty different order of business for healthcare systems whose role is to deliver services to create health, to manage health, to maintain health, and to restore health. So for the longest time, as a species, I don't know, for 99% of the time we've been on this earth, we were very, very healthy because we were lean and we were running around looking for food all day, and our bodies were totally attuned to the sun and circadian rhythms. And then if we ran into a tiger or stepped on a nail, we had a very quick, rapid death. But we really maximized our health span, but it was a very short lifespan. As we've modernized society and built our current healthcare systems, we've been obsessed with eradicating disease and keeping you alive as long as possible, and we've certainly done that, but we haven't actually focused on maximizing health. And that's really, I think, the biggest shift that in the journey of where health care has been on, is to now match your health span with this lifespan that we've so successfully extended. And so, what it's going to start to look like, and the path Canada's been on, and really every country on the world, has been shifting from, the system we've had, which is kind of 50 to 100 years old, based on a paradigm of what we call sick care, not health care. So reacting to the symptom or the disease and fixing it, from a pretty kind of crude, not very precise, and extremely analog modality of delivering services, very focused on buildings and facilities and clinics and institution centers, where we had to hold all the expertise, and you as citizens have to come to these places to get care. Duration that's been episodic and intermittent. So if you have a family member with diabetes, they get that one 15-minute appointment every 3 months, or you get the one MRI test if you have a brain tumor. You don't get a continuous view. A big power shift, as Andrea talked about, from really us outsourcing our agency to the expertise and the high trained experts in healthcare. And then finally, a metric and a currency of paying for and obsessing about KPIs around doing stuff, costs and activities and pills and visits, and paying per activity or per service. All that is now shifting as this public good, just like every other public good, is being reconceptualized around centering on the person who has the biggest stake in this work, which is you and I as the citizen. So it'll be predictive, it'll be personalized, it'll be decentralized, and even a new word has come to healthcare called omni-channel, which we've all experienced, in our retail and other experiences. It'll be much more continuous feeds of data. It'll be people-powered, as Andrea mentioned, and we're actually going to pay for health instead of paying for activities. Okay, so this is massive change that healthcare has been on, and this has been my obsession of trying to guide and accelerate the path to the right side of this slide. The drivers of what's getting us there are both pull and push. So on the one hand, there's a big pull of patients and family members who have had this awakening, this power that they've gotten, this agency that they've had in every other interaction with services in their lives, where they have all the information, they have the means of production, they have some agency of calling some shots. They're now demanding that from healthcare. They're going to pull us to the future, whether the system is ready to do it itself. You add on top of that a push away from the old model, because we're literally out of resources. So supply and demand are unsustainable. So demand has grown because people are staying alive a lot longer, which is an amazing success of our healthcare system. But more importantly, people are staying alive with mounting accumulated complex illnesses. And that just needs a lot of support and resources to manage. And even if we had unlimited money to pay for healthcare, so in Ontario, for example, if you take out what we're spending to service our debt, 50 cents on every dollar of our taxes is paying for healthcare. Even if we had unlimited funding, which we don't, we're kind of out of money, we will never be able to recruit, train, and deploy the human resources to meet the demands as they're looking. And so scarcity is a really good time to rebase. And then finally, there's technology to do something about the historical constraints around why we don't design for patients and why we're out of money, because we've had such a capital intensive model. So all to say, healthcare has been pushed to this journey. But what's worried a lot of people is, now that you bring software and technology into a previously analog industry, statements like this from Vivek Wadhwa, are, always going to be true, that more will happen in the next year or whatever of healthcare than in all the accumulated years before. But the clock speed, the cycle speed of healthcare is to change very, very slowly, because we've institutionalized controls and safety and ways of doing things that don't allow this institution to adapt so fast. And we have this kind of collision course where, the rest of the world has both gotten faster and faster at adapting things that make sense, maybe except for Angry Birds. So the speed is faster and the time at which new things come to society is faster. And healthcare has been fixed at about a 17-year time cycle, from something being good for patients and the health system to it getting adapted. And so as Jack Welch always said, if the speed at which the world around you is going faster than the world, the pace at which you can adapt and change, the end is near. And this is why those of us who are obsessed with health innovation are really trying to speed up our internal clock speed of health organizations to keep up with the change around us. And that's why most analysts, when they map healthcare up against every other global core sector, telecom in the northwest corner, and construction and everything, we're in the bottom right. We are the most susceptible to disruption, and disruption means a new entity or a new way of doing things very quickly replaces the old, even if the old has been the standard for 100 years. And very little on the vertical axis has happened for healthcare. We have not really modernized in the information economy at all. I think we're the last sector in the world to do so. And so, we've been wondering, just like every other legacy kind of incumbent who, had all of the employees, distribution, and access to customers locked up, taxis, hotels, media companies, Kodak, and the cinema, and retail, who's that going to be for healthcare? Because it's hard to see the incumbents in healthcare make a play. Okay, and so I'm just going to kind of get to the punchline of pandemic. So, a big part of why we haven't been able to modernize healthcare is because it's been built on a lot of these analog kind of objects, people and paper and pens and fax machines and pagers and CDs. These still are the infrastructure that drives the bulk of how healthcare is done today. And not only has this been a big challenge to information flow, access, getting patients access, and being able to use resources to the best of their capacity and as efficiently as possible, it has now become a major liability in the age of this pandemic. And so, my picture for this discussion is a silver lining. And, maybe we can see it on the chat. Does anyone know where this word silver lining comes from as a metaphor? So the idea being, it's cloudy, today, but you see the silver lining around the cloud. And that means, that the sun is coming, that the cloud is going to go away and things are going to be all right. Has anyone ever wondered why we use this metaphor? We use these all the time. Just want to see if there's any literature scholars out there. Okay, so this is going to be your useless fact.
I'm just going to drop that in. I just dropped it in sorry to interrupt.
Yeah.
Feel free to type it into the chat. Where does the word silver lining come from? Would love to see if anyone knows.
Okay, somebody can Google search and beat me to it. So, it turns out that, there was a poet from Ireland, John Milton, who, as part of a really long poem called Comus, reflected, there we go, Michael, on, he was kind of going through a rough time, and he's saying, who is this supreme good who's gonna keep me unassailed, despite all the terrible stuff I'm going through. And so, to reflect that feeling, he talked about, was I deceived, or did a sable cloud turn forth her silver lining on the night? I did not err. There does that sable cloud turn forth her silver lining on the night and cast a gleam over the grove. So that's a bit of what my message is despite the challenges we've had to modernize our healthcare system, this situation we're in is really showing us a silver lining, not just in healthcare, of course, in all of society, but I'm going to reflect on what it means for healthcare. So back to the chat. You guys are going to need to exercise your muscles. Let's take some inspiration. So tell me, what do these images of other, major global crises that have really created a new normal that wouldn't have happened or wouldn't have happened as fast if the crises hadn't hit? Anyone want to reflect on any of these? So the Black Plague in 14th century Europe, World War II, 9/11, and SARS in China. What came to the world and to social, capital that wasn't there? Anyone remember anything from these? You guys are a bit quiet on the chat here. Okay, let's see. So I'll just kind of get us warmed up.
It feels like 9/11 changed the way we travel.
Yep, so I'm going to mention that. That's good, David. So the plague wiped out a third of all Europeans, and it is credited with really ending feudalism and serfdom. So this is where the serfs were the more peasant, poorer people, mostly farmers, who were almost like prisoners or slaves, but not really. But they were essential to feeding the lords. And when most of the farmers in the rural areas got wiped out by the plague, all of a sudden these low-paid essential workers became very, very important, and they were able to organize. That's exactly what's going on right now with our, re-understanding our essential workforce, particularly in healthcare. World War II had a few things. I mean, women, this is how we got in the workforce. And then, a massive explosion of innovation in terms of products that, again, might have been there eventually for society, but they really got turned up because it was a crisis. And these really, have been, had a lasting impact on the world, notwithstanding the internet, which is what's allowing us to convene today. So that's happening in healthcare. I'll talk about it. 9/11, as we mentioned, yes, it did change pretty much overnight how transportation is done. But more importantly, what we're starting to see signals and learn from is all of a sudden society's attitudes, beliefs, constraints around privacy and security for the better good opened up, and that really changed forever. And there's conversations about that happening. And then finally, a lot we can learn from China, which was a bit more contained with SARS, although it hit here in Toronto a bit. But this really is credit for opening up e-commerce, because people could not buy things because of the personal risk of contact. And this created a new pattern and a new set of behaviors that stuck. And that really paved the way for Alibaba and everything after it. And we're certainly seeing this. I was just reading today, Girl Guides has gone online for distributing their cookies. And in Canada, Cineplex Odeon, is competing with Netflix, trying to charge you to stream movies into your living room. So back to those drivers I told you, were propelling us to the future of health. They've now been amplified at scale, and that's what's really pulling us to the future faster than ever. People and their families are changing their behaviors and patterns, as well as their care workers, because of this. There's a new acronym, ROPC, risk of personal contact. The demand curve of people, equipment, policies has far, far, far exceeded the previous supply. And so when you've got an imbalance, you innovate. You don't have time like we do in healthcare to have a committee, to have a task force, to have a report, to have a study to decide whether or not to do A or B. And then finally, on the tech side of things, digital has now come to the top of the food chain. And, we were always like the orphan cousin because physical was the dominant modality. And, tools and data and tracing and tests and vaccines has just amplified. And so literally overnight, I teach a university level course on the barriers to health innovation. And I could do a week on each one of these 10. They've dissipated, right? The barriers have been smashed because, we are all aligned on an outcome and there's no personal interests. And so back to Jack Welch, I've hacked the quote. All of a sudden, the inside, us in healthcare, are keeping up with the demand. And so when we can innovate at the pace that the outside world needs us to, more happens in healthcare in 10 days than in 10 years. Some would say in 25 years. And so I'm just going to kind of give you a smattering of a bit of, like, I'm keeping a log, right? Fee codes and reimbursement codes to pay you to have a doctor visit virtually or mental health are either free or, at least reimbursable. That's been a policy debate for 25 years. Health workers in the US are getting cross-licensed. So if you're a doctor in San Francisco, you can now go practice in New York City where they need you. That was not allowed before. That is still not allowed in Canada today. That's been a policy issue forever. People coming off retirement, med students are stopping school and getting in the field. Air Canada workers are being trained as flight attendants because they get training in medical things. They're getting upskilled to be health workers. Data, number 3, making data, moving data, transparency of data. 4, hospitals are building capacity overnight. That in a way they couldn't. We saw in China a hospital in 10 days. Trillium Health in Mississauga will open a facility very shortly. Drive-through testing, kiosks for testing. 2 weeks ago, it would take hours or days to get results from a test. Now it's in minutes. Self-testing, you name it. Reimbursement coverage, we found a way to cover non-insured individuals, new immigrants to Canada that needed to have a period before they can get access to health insurance. That policy got done overnight, and it goes on and on. And more importantly, these are all within healthcare. Other industries have lent their assets to our industry, both to help out, to keep their production lines moving and their staff working, but these will become ways for them to enter healthcare. Ventilators being made by car companies, apparel companies making masks and gowns. Canada Goose, I think, is going to make 10,000 gowns overnight. Our brewers and our distilleries making sanitizer. Our financial services institutions have stepped up in many ways, and banks, and it goes on and on. And then finally, just massive solidarity across generations, across organizations, across provinces. We're expecting a shipment any day now in Ontario from Alberta of personal protective equipment for our health workers because we can't, we're caught up in the supply chain issues. Federal, provincial, international, you name it. So there's some great silver linings. And, these historical artifacts, now are, that have been risks are now being able to be managed, both in a digital and physical way, in a way we didn't think was possible. So I'm going to stop there and maybe we'll move to some discussion. Hopefully that gave you a good sense of, what I'm excited about, what we're seeing, and rest assured, I think we got your back in healthcare. Thank you.
Thanks, Zayna. There's questions coming through on both. So I'm going to start off with when Zayna and I were chatting before we went live today, and we were just having some good conversation. And one of the first questions I'm sure that so many of you have is, as we look at what's happening in the world today and with COVID and the healthcare system, Zayna, what has surprised you the most in the way in which we have responded to the COVID outbreak, as well as to the changes that have happened?
So I'd say, I mean, I've got, that could be a PhD thesis of surprises, but I'll call out two. I think the one surprise, I guess it's a surprise, is the cracks in the healthcare system that everybody's been talking about. I'll say, a couple I'll call out: public health in terms of its prominence, and how we treat the aging population, particularly in long-term care facilities. This has been talked about by people who don't have power and influence, and those have all been exposed. I don't know if you guys saw last week, Malcolm Gladwell did a session with the Monk Debates live on Friday night. This guy sees everything, right? And then he got asked, what's the one thing you think is going to come out of this that's good? And he said, the prominence, importance of public health will go back to where it should have been, right? So, and it's really validated that. I think the second is just, as I showed on my inventory slide of silver linings, just the ingenuity, people are just getting it done. And I'll tell you, when I talk about the barriers to innovation, the number one barrier I always talk about is mindset, culture, how people think. So we always say in healthcare, we're so risk averse, we're risk intolerant, we love status quo, nobody wants to change. I'm not seeing that in the response of my peers and colleagues around the world. And that, I think surprised me delightfully.
Related to that, and I'm seeing a couple of people ask this question in different ways, you talk about silver linings, as we think about the silver lining of COVID-19 and this pandemic, and certainly when we start looking through the lens of things like technology, patient care, even things like distributed ledger systems. What do you think some of the silver linings, like you've given us silver linings, but when we look back, I'm asking you to be a little bit of a fortune teller here, but what do you think we'll look back and go, look what came out of this?
Yeah. So it's a bit of what I alluded to can you guys see my slide here?
No.
Yeah. So now imagine there's a column for this, in 10 years when my daughter or your daughter is giving this talk, Andrea, what are we going to say, right? And I actually think it's all of the four before. I think we're going to have a return to valuing and paying for the people who keep the world going, not the executives, that we will have a proliferation of new tools that, just wouldn't have been there before, that are going to be infrastructure that will be used well beyond containment of a virus, that we're going to have a new way to survey and monitor early signals of data, like the security, privacy. And most importantly, I think for our world, is these new habits and patterns that both our patients and families and our clinicians have now finally played around with, and they kind of work, are going to stay. So the best estimate my colleague Will Falk kind of just posted yesterday is, so today we know most are moving to about 80% of what they're doing that used to be only in person is now in the virtual domain in healthcare, not in work meetings. We think it'll land at least 50%. So that's going to be a game changer for the economics of healthcare. It's going to allow us to do a lot more with a lot less resources and meet patients in the channels that make sense to them. So I think that will stay. And like I said, I think public health and science, good science, will emerge. And I think anti-vax will go away.
Interesting. There is a question actually about bringing together the different modalities of medicine. And Allison says, how can we bring together some of the lesser known, more traditional forms of medicine, like Ayurveda or naturopathy or homeopathy into pharmacology? Is it something that you're seeing will be a part of this?
Not from the pandemic at all, but that path. And I don't think that's the right lens or framing. The framing is more what we call holistic health or holistic care. In one of the projects we're doing to reinvent home care, we don't talk about medical care or health care. We talk about life care. We're in the business of helping you meet your life goals. Some of your health situation affects your goals for your life. So medically, we're trying to deal with those things, but we're not obsessed about the medical. And I think that's what's going on around the world. The intermingling of physical, social, and emotional well-being, it's indisputable. And so we have had a very, what we call somatic or physical or body focused form of medicine, because that's what the science of medicine is. And that's kind of not working for us. When people have what we call life sucks disease, stress and light and all that stuff, so that was already happening. And I wouldn't say the pandemic has accelerated that. I just think that's kind of, the only way to create health.
Right. So just to paraphrase that, I think, so what I'm hearing you say is that what the pandemic has helped us to understand is that there's a separation between the science of health and the wellness of body. And when we understand that wellness is all of our, like we need to be thinking about wellness. And the science of health is important and will continue to be important. And we're seeing that there's many people working on this, but we have an active role to play in our own wellness. And that's what we're learning through this. Is that fair to say?
I think that's fair to say, for sure, because people are seeing it. There's the COVID-19 for weight gain. People aren't sleeping. I mean, I wish I showed the slide. There's a great curve. Can I just do a quick hack right now? Because I think it's going to be, I'm just going to take off the share. I'm off the share screen, right?
Yeah.
I'm just going to open one image because I think it's really, really important for what you just said. And, this one's kind of started to go viral. And it's certainly a lot of what we're trying to plan for. So if we, this is a guy named Vector Sting, I believe. Let me just share this one here. Okay. So, us in healthcare, we're obsessed with the purple curve, making sure we have ICU beds and ventilators, flattening the curve, blah, blah, blah. You guys know that. What's happened though, because elective procedures have been canceled, because, you might have had a normal visit with your respirologist or your endocrinologist once every whatever, those have been canceled. The green curve is going to be us catching up with the backlog of all the deferred care for people who have pretty complicated illnesses. Then the blue curve is going to be all the people we care about, aging adults at home who've had interrupted care. Their stuff's been canceled because, whatever, their nurse is in quarantine or they're in quarantine, and that's going to build up. But those all go up and down because they've just been deferred. The red curve, folks, is the estimations of trauma, mental illness, burnout, moral, economic injury, all the impacts on mental health of our society. We are not ready for this. That's an outcome of this that's way, way, way worse than the physical health implications. Every organization, every employer, every policymaker, and for sure every health organization, we need to be working now on the red curve.
Yeah, I saw this image this morning somewhere, and I think it's so telling to what is actually happening. And I think one of the things that, and I just saw somebody posted it in the chat, that I think is, it should be added to that, which is the privacy aspects. When you think about what's happening right now in the world around privacy, because we have to be transparent and open. What do you think the long-term implications are on privacy?
This is not my area of expertise, but I definitely read a lot. And that's the discussion right now. I mean, this is now coming to Canada, right? So we already know from Singapore, Taipei, of course, China broadly, Israel, and now France, and even Bahrain, they've put in pretty extreme, what we call contact tracing. So, a way to tag who has had it, who has it, and then you'll know if you've run into them. And of course, you guys probably saw Apple and Google joined forces and announced, I think yesterday, you can consent to be into that contact tracing yourself instead of the state mandating it. So we're going to have a conversation around, do we want this level of surveillance? You weigh out the public good, and I don't think I have the answer yet, but I bet you there's a lot of other smart people thinking about that. So maybe that's your next your next lunch talk, Andrea.
Yeah. No, privacy. I mean, look, the genie is out of the bottle, and the question is, how do you put it back in, right? I mean, it's a big one. There are a lot of questions that I'm seeing come up quickly around technology and the impact of, what are the shifts that you're seeing the technology will have in the future on how we treat things like COVID, or even diagnose? Like, what are you seeing in terms of technology?
Yeah, so again, I mean, in my Future of Health talk that I normally give, I talk about so many ways technology is allowing us to, either do the things we used to do before, but do them faster, cheaper, smarter, better, easier, widen access at low cost, or they're allowing us to do things we couldn't do before in an analog or human way. So that is consistent and continues here. So just a couple examples, right? So somebody had put in the comments, remote monitoring. Well, remote monitoring just means, let's say your mom or dad has a heart condition. Instead of them having to, come to the clinic to do their blood pressure or whatever, you could just do that at home, right? And, with a bunch of different tools that are very easy. That's been around, but the business model hasn't been there. It's exploding, right now. And TELUS has been very aggressive with promoting their modalities. We're certainly doing it, and many others. So again, these things have been around. There's a use case that seems to have a value prop for everybody right now that maybe wasn't there before. I think on vaccines, there's just been an explosion of ways to create a vaccine very quickly. So there's a company out of the US called Moderna that already is in clinical trials, for a vaccine that really tricks biology to target this thing, so the best estimate is, sure, we're 12 or 18 months out, but if things go well, that could be as early as 6 months for all we know. And then testing, right? So a Canadian company, Spartan, I think they're based in Ottawa, just got a contract to produce 1 million self-testing kits for you and I to use at home, right? These are just as quick as it is to step on your weight scale or do a thermometer, you can test for COVID. Think of everything in the supply chain that goes away when you can test at home. You don't need to go to a clinic. You don't need somebody to swab your throat. You don't need to wait for that swab to go in a car to a facility to get tested and then the data to be, all that goes away. So that's what's, again, all these tools have been on their way. It's just there's a use case. We could test the business model now. People get used to it. They try it. And it's going to go a really long way, both to contain this pandemic and, more importantly, just like what happened in World War II, put us on a new normal to kind of rebase the healthcare system afterwards.
Okay, one last question, and then we'll let you go. So, as and you and I talked about this when we were waiting, which is looking at where we are and the predictions of what are you seeing in terms of the future for all of us who are self-isolating at home, for the way in which business have been impacted by this. Is this something we're looking at for the foreseeable future? I know you're sort of in some of those conversations, so I'll leave that with you.
Yeah, so I'm leading what we call the plan ahead team for my organization as a future strategist. While 99% of the resources are dealing with the crisis today, which is a big one, we're a little cell on the side that's just trying to gather intelligence to help us make smart decisions now. And so our best intelligence today is saying this, and this is for everybody to know, right? Here's the order of logic. Okay, first, until you contain the spread of the pandemic, you can't change how we work and live. Until you change how we work and live, then you can't change the economy. So contain the pandemic, change how we work and live, then change, get the economy back firing. The unknown is the first step, because if we don't know if we can contain the pandemic, because we have yet to do, at least in Canada and the United States and some of Europe, the most extreme measures from a policy level. We haven't done full testing. We don't have contact tracing. So if we do those things, we're going to be on a V-shaped recovery, right? We went down and we're going to come up, maybe a U, but that's what we know. If we don't do those things, it's going to be either like a weird up and down spiky for at least 18 months. And if we definitely let things go, like let's say if Italy didn't act the way they did, we're in an L, right? We are going down and we are not coming back for a long time. And that's, the equivalent of that would be Greece and their financial collapse, or Japan back when they had their collapse, they didn't, bounce back. So that's kind of how we're planning. So you got to be ready for any of those scenarios because we're not in control of those policy levers.
So it sounds like there's still a lot to happen before we can even look at any of the timings that might be associated with how long things will be going. There's just too many unknowns at this point.
Too many unknowns, but you can have 2 or 3 working scenarios, and the intelligence about those scenarios changes literally by the day. Mm-hmm. So today in Ontario, our premier announced, for sure 28 more days. Okay, that's our next planning horizon, right? Most experts around the world are thinking at least end of August. My friends who are professors at universities are saying they're not planning to start opening up the school in September. So, you got to have a working plan for all those scenarios and be ready. And then you got to know when to pull the trigger on your strategy.
That's fantastic. Thank you, Zayna. Thank you so much for sharing all of what you have with us today. This has been incredibly enlightening. And Zayna is actually one of our roster speakers here at Talk Boutique. And she has graciously said she will do virtual lunch and learns or speaking engagements for anyone who is interested. She's working 18-hour days right now. I don't know how she could find the time, but that is out there. So I leave it for anyone who might be interested in bringing Zayna into their organization virtually to do a little bit more of what we've just done today. And I'm hoping, Zayna, that you'll agree to come back and do one of our Changemaker 20 Ask Me Anythings, where we can just do a Q&A, because the questions were just pouring in, and I certainly couldn't get to all of them. But for those that we didn't get to, we will make sure to try and get some answers back to you. So I'm hoping you'll agree to come back.
I can't say no to you, Andrea. You know that.
I love that, Zayna. Thank you. And for those of you who are here, we have Drew Taylor joining us tomorrow on the Changemaker 20. Dr. Drew Taylor is an expert in regenerative medicine. He actually has a business that banks stem cells. And this is something, as we start to look at the future of medicine and some of what Zayna just talked to us about, Drew is actually on the cutting edge of doing some of that. On Thursday, we have Mary Trudeau joining us. She is a water scientist, and she's speaking specifically to the mental health aspect of what's happening in our world today and its impact on our scientists and on the rest of us. And then on Friday, we have Dr. Sherry Welling joining us, and she's going to be helping us to understand the mental health and well-being of parents who are now working from home and parenting at the same time, and giving us some tips on that. So we have a jam-packed week of really great experts every day this week. We're hoping that you will come back and join us. In the meanwhile, stay safe, stay healthy, stay connected. And thank you again for joining us. I'm Andrea Sampson, founder of Talk Boutique. I will be here throughout the week. Take care. Thank you.
Bye.
Bye.